welcome to the next episode of The Simple Dermatologist, where we're going to discuss the side effects of isotretinoin, otherwise known as the drug Accutane. We have a lot of patients over many years treated with Accutane. Accutane was first approved in the early 80s, and millions of people have been treated. There's a lot of publicity about the drug itself because of things that have happened to people while they've taken it. It is still the mainstay of therapy for patients with refractory acne, which is acne that doesn't improve with our standard therapy, or patients who come in with severe scarring and cystic acne on the body. So when patients are put on Accutane, the dermatologist should go with a list of potential side effects, and I'd like to discuss those. So the number one side effect that we discussed is a word called teratogenicity, which is birth defects. So anytime you pick up your prescription of isotretinoin, and every time you unwrap an individually wrapped pill, there is a picture of a pregnant lady with a big red no sign labeled on top. Because if you are a female who is on Accutane and becomes pregnant while taking Accutane, that baby will have a skeletal deformity. Now for males, there is no risk to current or future reproduction or fertility, and this does apply to females. However, it is important that males or females do not share the pills while on therapy to definitely decrease the risk of birth defects. The number one side effect I tell patients that they're going to have, this is 100% of patients, is dryness. That'll be dryness of the eyes, dryness inside the nose or the nasal mucosa, leading to nosebleeds, dryness of the skin, often resulting in extremely dry lips, cracked lips, as well as eczema, especially on the arms and the back of the hands. And rarely we can also see dryness on the outside portion of the GI tract, especially anal fissures that can occur and be painful. The second most common side effect that I'm going to see at a much lower percentage, I'm going to estimate somewhere between 5 and 20%, are going to be joint aches. Joint aches commonly occur, especially in the lower back, knees, ankles, but can occur anywhere. They often occur at the higher doses of Accutane that we see, especially when we start to get into 60 and 80 milligrams a day with the dosing. Another side effect is ingrown nails. We also see that has to do with the way isotretinoin, which is a derivative of vitamin A, kind of changes the speed at which our nails grow. One mention I do want to say about joint aches, if we do see joint aches, we do find it's a dose-dependent thing. So if someone has joint aches, we can often lower the dose and hopefully resolve some of those joint aches. Another side effect that we see is headaches. They do not occur commonly, however, can be associated, especially with the higher dosing, as well as decreased night vision. That's also clearly stated on the label. Anytime we have the combination, though, if a patient's having severe headaches along with blurry vision or changes in vision, this can be the sign of a rare side effect called pseudotumor cerebri, and this is where the circulating fluid around the brain builds up pressure, putting pressure on the brain and the nerves leading to the eyes, known as the optic nerves. Past that, we do check labs while patients are on Accutane. For a female, we check pregnancy tests, as well as lipids, as well as liver function tests. And for males, we check lipids and liver function tests mainly. We do see, especially if a patient has a family history of high cholesterol and elevation in the lipids when patients take isotretinoin, especially at the higher doses, we can also see elevations in the liver function tests. A rare but not uncommon side effect is going to be hair shedding. This is a reversible side effect. Once again, extremely rare things that have been noted are decreased hearing, mood changes, such as depression, suicidal ideation, patients who've committed suicide, GI disturbance, such as inflammatory bowel disease. That includes Crohn's disease and ulcerative colitis while patients have been on Accutane and afterwards. Some of these things can be controversial in the medical literature, but I always mention them to patients. And once again, it's important that patients on Accutane do not share the pills or donate blood for 3 months after stopping the drug. If anyone has a side effect on Accutane, it is important that at your monthly visits that you tell your dermatologist so you can work through ways to minimize those side effects because untreated side effects can be dangerous to our health. This will be the end of this episode. In the next episode, we will talk about how Accutane works and how it does give us a long-term, potentially, improvement in the acne.